Okay, thank you so much. Then I'd like to know how APIN is supporting awareness and demand for PrEP, considering that, especially long-acting PrEP, considering that it has not been fully, you know, will I say, integrated into the national HIV framework. How do you think APIN is supporting the awareness and demand creation for it, particularly among women, young people, and vulnerable people?
Yeah, thank you. For us in APIN Public Health Initiatives, we support awareness and demand creation for PrEP by integrating PrEP education into our messaging in our sites, in where we support both in the facility and the community. So for this that's coming out already, there are messages just to even enlighten people to say these are new things coming up, so that when it becomes available, they won't be hearing it for the first time. So integrating these messages in the facilities, in the community, among different groups, adolescent group, young people, people at higher risk of infection, vulnerable groups, and the like. Then we do a lot of capacity building. We train healthcare workers on a lot of issues that has to do with healthcare, HIV/AIDS, maternal and child health, and many others. So already this training also involve the youth-friendly services. What kind of services people would like to have, key populations, adolescents, young girls, boys. What we call patient-centered care. People-centered care. So capacity building, training of those people. Then we have a lot of community-based organizations and civil society that we work with. So they are also a major pillar in our effort to change the narrative. So we have a lot of CBOs, a lot of civil society organizations that we work with. So this also allows us to, create that awareness, that education, and that will help people to do this work very well.
Okay, thank you so much. This question is going to be around sustainability. There is a lot of global funding on certain things. What steps are being taken to strengthen local capacity and domestic financing for HIV prevention?
With global funding uncertainty is growing. Nigeria is actively pursuing several complementary avenues to strengthen local capacity and boost domestic financing for HIV prevention, treatment, and care, and even for the public health response as a whole. Recently, you'll see NACA effort in advocating at the Executive Council and the National Assembly for increased domestic resource mobilization, which is key. One of those things is expanding what the Basic Health Care Provision Fund and the launching of the National HIV Trust Fund, which was launched during the past administration. Also, as local implementing partner capacity, we are also capacity looking for complementary funding as programs are being transitioned to indigenous organizations, so that we can have other complementary funding to support service delivery. But the best thing is actually us as government, working with government, looking at our resources, providing that domestic financing. One thing that Nigeria is actively pursuing is the implementation of the total market approach for HIV commodity to improve the sustainability and accessibility of prevention products like condom, HIV self-test kits, and pre-exposure prophylaxis by involving both the public and the private sector. So we have a lot of private sectors which they can fund this too. One of the things in Nigeria, you see a lot of private sector, they may not take it funding as a priority. Maybe they are more of things like social events, things. For example, you see the funding that goes to Big Brother Nigeria. So we think that funding be channel to healthcare. So we need to begin to also work with the private sectors, the banks, the foundations, the big companies, to begin to channel the corporate social responsibility to healthcare, really, because healthcare delivery is social good.
Thank you so much, Doc. So, final one. In your view, what would be the next critical actions at both policy and program levels to ensure equitable access to injectable PrEP in Nigeria?
Further introduction of the Dublin Capote Gabriel into national policy, and already there's also ongoing discussion about the Nakapaville already in country. Some immediate steps will be to begin to develop and issue a rapid advice on this, to say this is how we are. But I know that will happen. Some pilot studies have been done on CAP-LA here and there in some states, and some will also happen for Lenacapavir. Sometimes, some few months ago, Chai actually brought an RFP out on, United brought an RFP out on how countries can roll out Lenacapavir, which I'm sure a lot of implementing partners responded in Nigeria to that RFP. So we also need to update our national guidelines, training curriculum to reflect these new realities. Then also develop that healthcare system approach delivery. Like I said, is this injectable? It's a little bit different from tablets. So to look at how will the health system, be able to do that and do that. At the program level, we'll begin, one is begin to look at our own strategies. When this happen, how will this be rolled out? Begin to plan and also look at the monitoring and evaluation system. How can this data collection, because you need data to know whether this is working. And of course, because some of the new drugs, we also need to strengthen pharmacovigilance and resistance surveillance. You need to pay attention to say how are people who are taking this, you report them, because this is a new product, and at least we will have to put an eye and an ongoing surveillance on it to ensure that there are no adverse reactions in people. Are you there? I'm true.
Oh yeah. Well, thank you so much, Doc. Yeah. Just final thoughts. What message would APIN like to share with policymakers, youth advocates, and the public about the future of HIV prevention in Nigeria?
For us, we are a willing and a ready partner, always willing to support the government of Nigeria, support the community, civil society in the delivery of high-quality HIV prevention care and treatment services. We've been in this business for close to 25 years, and we are known for quality. I want to assure them that we'll continue to deliver our intervention, ensuring that our patients get the best at a place that is close to them, in a manner that work with their schedule. So in essence, I'm talking about a patient-centered care. Must receive care in that way for chronic diseases, especially, so that they can be retained, they can be virally suppressed. For the government, we are always willing to be, as we are, a technical partner to support government in the rollout of any new intervention to ensure that Nigerian people are in for the best. Like our motto, we're here to improve life and improve the health of Nigerians. Thank you.
Thank you so much, Doc. I really appreciate the time taken out to join us podcast series. Yes. Once we're done with the editing, I'll send you a link so you can also listen to it. And
Okay.
because of the sensitivity of the project,
Mm.
we are producing the podcast series in audio version only.
Okay.
So we'll share the link with you once we're done editing it. And also I don't know if it's okay to tag you on our social media handles. Is that okay with you?
Yeah, but first, share the link with me. Let's listen to it.
Okay.
So once we give you the approval, then you can do that.
Okay. All right. Thank you
Yeah.
so much, dog. You have a wonderful day.
Yeah. Thank you.
Yeah.